To Greg Nigh, and welcome back to the deep dive. Hopefully, you've seen several others. Today, I'm just picking one kind of a topic. I just saw this article in the press and made me think. I bet there's something that needs to be told here. So, I'm just going to cover one topic briefly. I'm going to try to share my screen here, and hopefully that will work. Let's go with this. Let's see. Does that get it? Yeah, so I think you can see it over my shoulder here. So, okay, the headline says over 20% of sexual health related TikToks found to contain inaccurate information. All right. Well, so my first thought was, wow, 80% of them are accurate. But, okay, 20% inaccurate. And the implication of this is that, okay, don't get your health information from TikTok. You got to get it from reliable sources. And of course, sort of the gold standard reliable source are published, peer reviewed, published articles, right? And of course, you know, there's like a there's like a layering that happens. You get the published article, uh, but when you read about, sexual health related or other medical information, it's really uncommon that you're reading the published article for the most part, the general public. So what happens is the article gets published. There is a headline that gets generated from that. And then, the headline sort of tells what was in the article. And then that becomes kind of the health information. And often then doctors are reading the same headlines and, will pass that information on. But there's sort of a hierarchy where you start with the published article and then it filters out all the way to things like TikTok, where even 80% of information on TikTok is accurate. But there's this 20% that, we got to go somewhere else for our accurate information, right? So, to just put this in context, there are several studies that have looked at how accurate is the information in peer reviewed published articles. Gold standard, right? So here is one accuracy of the data. The results show that the proportion of deficient abstracts vary widely, 18 to 68%, in the six major journals that were studied. And that is to say, the abstract, which is what a large number of people are reading, they're not reading the full text of the article. The abstract, which is what ends up creating the headline, the health news or whatever, nightly news, it's based on the information in the abstract. So here's a study finding that up to 68% of abstracts misrepresent what is actually in the article. 68% of them. I mean, TikTok got it wrong on 20%. 68% of peer reviewed publications have misleading information in the abstract, meaning that what's in the abstract doesn't correspond to what's in the paper. All right, that's interesting. Here's another article. The article classification and prevalence of spin in abstracts of non-randomized studies evaluating an intervention. So spin is to say, let's say you're trying to determine if a drug improves a condition. And you do the study, and in science, there's something called statistical significance. And that's represented usually in the p-value. And it is to say, I mean, basically, the p-value is saying if there is less than a 5% chance that this benefit that we're seeing could have happened by chance, then we attribute the change to the drug. So, you give a medication and some number of people get better with whatever condition. Now, just if you gave a placebo, some number might just accidentally get better because people just happen to get better and worse. But if so many people get better with the drug that there's less than a 5% chance that that had to happen just randomly, then that's called statistically significant. And then you attribute the benefit to the drug. So, what this and other articles are pointing out is that often what happens in articles is that when they are explaining the benefit of the intervention, which they want to portray as good, that it's a valuable intervention, they will uh, present it as a benefit, even if it doesn't reach what is called statistically significant, meaning there's greater than a 5% chance that the benefit they found was just due to random variation. So by scientific standards, and this is across the board in the medical sciences, the that significance level is set at 5%, meaning it's got to be 5% or less chance that it could have been a random event that the effect seen happen. So commonly what journals do is they spin it so that they present information that is not statistically significant, meaning by definition, it could be just random, but they present it as though it is statistically significant. And so it then gets, propagated through the chain and headlines get created and news about a great new drug gets put out there based on false information. So yeah, TikTok's got it, and so do published journals. Here's another. So in this particular assessment, look at this: 128 assessed articles. 84% of them had at least one example of spin in their abstract, meaning the kind of thing that I just described. 84%. So abstracts, which again, this is what's getting read by science journalists who are looking for the story that they want to break about the revolutionary new drug or whatever. 84% of those abstracts are spin. And they give in here frequently strategies are linguistic spin, inadequate implications for clinical practice, lack of focus on harm. I mean, all these different ways that researchers want to spin their data, put it in the abstract in a positive light so that it gets the headlines. Here's just another example. Level of prevalence spin in published cardiovascular randomized clinical trials. These are the top-notch kind of trials. Reports with significantly statistically non-significant primary outcomes. So this is exactly what I'm talking about. So this is the spin where the outcome that they were looking for was not significant. The intervention didn't lead to a statistically significant benefit, but they spin it in such a way by squishing around their numbers so that in the abstract they can make it look like it was significant. And this is happening in a significant number of papers. So 93 reports of these clinical trials from 6 high-impact journals. It was found in 57% of abstracts and 67% of main text. The abstracts were actually better than the main text of the papers in terms of how much spin they're doing in these things. So the point is, okay, TikTok, 20% of that information is incorrect. Well, heck, look at what we have with our published literature. And the reasons behind this, I'm going to be talking about it in another podcast. So be sure to subscribe and like and do all that stuff you do. But the reason for this is kind of the way the institution of scientific research is built right now, which is tragic, and it is completely squashing innovation within science. That's all another story. The thing that you need to ponder, do I have another? Yeah, so some take home messages here. So, okay, don't trust TikTok for your medical information. It's 80% accurate on that one topic, but you can't really judge by watching TikTok whether you're watching accurate or inaccurate information. Don't trust health headlines or network news for your medical information. They're getting their information from abstracts. Abstracts are generating headlines. Abstracts, they're combing the abstracts to look for positive results that they can announce as the next greatest thing in health research. And then the journalists, they see the author associated with that article and they call up and they quote the author, and it's all very cookie cutter. So, given what we now know about the way that information is misrepresented in published literature, you can't trust health headlines. Don't trust search engines or AI for your medical information. I ain't saying don't use them. I'm saying don't trust them. Now, there's a whole thing that can be said about which search engines are more trustworthy than others. I won't get into that. Yeah, I won't get into that. We all know that there are search engines that are putting heavy filters on findings so that the things that they don't want you to find show up on page 25 of the results, and the things they want you to find are up at the top, and those rankings are not necessarily based on what's accurate. Um, with I use it multiple times a day. I'm not saying don't use it, but I always double check what it's feeding me, because we know that AI is notorious for giving false information. It doesn't do it, in my experience, it's not as bad at it as it used back when it kind of first came out. It would just make up study titles and authors and publications and just make it up out of thin air. I don't see it doing that much anymore. And so there, in many ways, I think that AI is improving in that regard. And there is some AI that is specifically designed for medical research. There's illicit, there's consensus, I think Grok 4 is pretty good when you have it do a deep dive. So the point is, you can't just, do the search and what it comes up with is the answer to your health question. And then, the final, don't trust published abstracts for your medical information. So in many ways, or many instances, I mean, people very commonly let me know that they've done research on, whatever their health condition is. A small fraction of those people who are stating that are going into the medical literature and searching the medical literature for on their topic. And of the people who are doing that, it is exceedingly rare that people go on beyond reading the abstract, which we just found out. I mean, you can have damn near 90% of abstracts misrepresenting what is in the actual paper. Almost everybody who makes it to the medical literature and knows how to get there and do searches there, almost nobody is reading the full text of an article to find out, like, what's the nugget here, and make sure that there's correspondence between those things. I'm not saying don't go there and do that search. It absolutely is, it can be quite valuable. Um, and not everything is misrepresented. It just that it commonly is, and everybody wants to publish positive results. Researchers nor journals are really much interested in publishing a result that is negative, that shows, oh, the thing we thought is not really true. Those don't get published very much. So there's a lot of pressure on researchers to make their results look positive. So keep that in mind. I think I have one more. Oh, yeah. So who should you trust? That's a good question when it comes to health information. So, you know, um, first thing, your doctor needs to be a geek. And what I mean by that is that it's not sufficient anymore to kind of just accept what's being brought at us as clinicians. Sort of, I mean, certainly not not via headlines or kind of the popular articles about what new therapies are available or whatever. So you want to make sure that whatever healthcare practitioner you're working with, now, you know, I maybe not your massage therapist or your Reiki practitioner or something, but maybe. But the point is, you want somebody who's actively engaged in kind of crunching numbers and looking at the details of the studies that are getting published. Your doctor should be able to answer all questions you ask without being defensive. I can't even tell you how many times patients have told me about these pretty miserable experiences they had in a visit with a conventional doctor where they ask very reasonable questions about, maybe a therapy recommended to them, or maybe a therapy that they heard about that they want to get more information about. And the response from their doctor is either condescending or dismissive or just outright angry. I mean, talk about a flag. Like, get the frick out of that office ASAP. You don't want to work with a practitioner who is unwilling to entertain questions. Like, docere, that's what it's to teach, to kind of educate, guide. That's the job of the clinician. So if they're not willing to engage in that piece of their job, out. Your doctor should, without hesitation, occasionally say, I don't know. That's a good question. I'll get back to you. I mean, we can't possibly, no clinician can possibly know everything about every condition we're dealing with. There's no way. And to pretend to have that knowledge is, I mean, it's just bogus. It's not a real thing. Um, and I would say you want to be sure that you're working with a clinician who is willing to say, I don't know. That's a great question. I don't know the answer to that. Uh, I mean, it's a common. People ask me why they have this or that condition, and I don't know. People are weird. It's true. People are just weird. Weird things happen. People like do weird symptoms that, I mean, I can come up with a story about why it happened. Maybe that story's true, but I got to go do more homework to figure out if there's a legitimate tie between the symptoms that they're describing and what I think is going on as an underlying process. The point is, I think these three simple rules. I'm sure there are more. This is where I say put them in the comments if you can think of other things. But these rules kind of help to narrow down the kind of practitioner that you want to be working with, to help kind of sort through the various questions, um, questions that come up as people are figuring out what's wrong with them, why it's wrong, and what needs to happen to make it work better. There are, certainly underlying principles that can be universally applied, but then there's this constant rain down of new data, new information, and and you need to work with someone who is filtering that, who kind of knows that it's loaded with impurities that need to be filtered out and can, sort through in vivo versus in vitro versus clinical, preclinical, all that stuff to know how to kind of translate the data that's available into a meaningful kind of approach clinically. So that's all a very roundabout way of kind of pointing out the irony that TikTok is 80% correct. And lots of published articles are not to say incorrect, but they're spun in such a way that they look more promising than they really are. And so we can't just rely on the abstract or certainly the news headline to be giving us the accurate information about health. So if you have any other specific questions for me, of course, leave them in the comments. I will have more to say about kind of the demise of science that has transpired over the past 60 years or so, 60 to 70 years, which is tragic. But those will be coming up in other podcasts. Be sure to subscribe, be sure to like, and please do leave comments if you have them. And I will be back before long with another. Thanks so much.